Hi, this is Jenny Villanova, and this is the last part three of NSG434 Pediatrics Topic 1 Immunizations. This is part three and the last part of the immunizations lecture. So, moving forward, reporting and safety is important, and at the time that the immunization is administered, the CDC requires by law that the healthcare provider gives the parents or caregiver or the client themselves a vaccine information statement or VIS, and this VIS can be obtained from the cdc.gov website, and they need to be provided this information before the vaccine is administered. It identifies any potential side effects, adverse reactions, risks that they may, be concerned about or want to have further discussion and some client education about. And additionally, we want to consider the next thing, which is contraindications and precautions. Parents do have quite a bit of fears about immunizations, and some of those fears include administering combined vaccines overloads the immune system, but rigorous study and safety, has been determined based on research. Also, some parental fear may be related to natural immunity, that too many vaccines decrease the child's immunity. Another concern the parents may have is that vaccine can cause asthma, arthritis, diabetes. And last but not least, an additional parental concern can be that shots are painful and cause discomfort. So again, these are all teaching opportunities, especially that shots are painful and can cause discomfort. We can teach about administering acetaminophen prior to the appointment to help relieve some of the discomfort, and there is a topical called Emla cream that can be ordered by the healthcare provider to be applied to the injection site. However, that cream needs to stay in place for an hour and can cause the immunization well baby checkup to take a little bit longer, but that's a parent's prerogative to choose what they want to do. Let's see, contraindication example may, especially with administering of live vaccines, that is that varicella and the MMR should not be administered to a child who is severely immunocompromised. That is, if they are, like example would be a child who has leukemia and they've had chemotherapy, and they are still, having treatment. Varicella and MMR is not advisable at that time. However, there are windows of time which these children can receive these immunizations, and it's important that that is up to the healthcare provider or their oncologist. And then adding the risk for adverse side effects from the vaccine in an already ill child can also be a parental concern, or mistakenly identifying a symptom of the disease as having been caused by the vaccine. Can also be a fear or a concern for the child. If the child is scheduled for vaccination is not feeling well, the healthcare provider might decide to reschedule the shot for another day, or for that matter, the parents may prefer to schedule the shot for another day. And I've done that quite a bit, help them to figure out when's a good time to plan to come back and get that immunization. And here's a picture of the Emla cream that I was talking about. It's a cream that's applied to the injection site, and then there is a transparent dressing put over it, and it needs to stay in place for about an hour to take effect. So again, it's something that the healthcare provider could order to help alleviate some of the pain and discomfort if that's a real concern of the parents. However, do be mindful that it will, cause the visit to take a little bit longer. Here's a diagram of positioning the child for immunizations, and always involve the caregiver, like we talked about with physical assessment. The caregiver or the parent is the best person to help hold the child, because the child is more familiar with that person, and they have a definite bonding, rapport, caring relationship established there. So be flexible, provide options regarding the multiple vaccinations. And as I said, schedule them again at another time. That's perfectly fine. Recommending administering acetaminophen 45 minutes before the appointment. That does help to alleviate some of the discomfort. In your textbook, your pediatric textbook on page 846, family-centered care is a good area to read and to be familiar with because, as you know, College of Nursing loves those application style questions on your exams. And let's see, I think I pretty much covered everything I wanted to say here. Administration, be aware of the length of the needle, as you can see here. For the anterior lateral thigh in infants, we're going to use 1 inch, and for toddlers, we're going to use a 1 inch to 1¼ inch needle, and for older children, 1½ to 2 inches. The bottom line is we want to get that immunization deep IM, and we want to make sure that we have a needle that is the appropriate length based on the child's mass and the size and their muscles. Multiple injections can be given at the same area, but they have to be at least 1 inch apart. So we can give 2 immunizations into that vastus lateralis, but we just have to make sure that they both are at least 1 inch apart. In your textbook on page 847 is an evidence-based practice box. Do be sure to study and to read that. And as I had said earlier, the dorsogluteal muscle should be avoided at all times. There is concern about the sciatic nerve and also the fact that we really do not have good seroconversion data on use of that site. Anterior lateral thigh is wonderful in the infants, especially pre-walking, but once those kiddos are up and walking, we need to use the deltoid, because if we give an injection in their thigh and their leg hurts, they're not going to want to walk, and now we have a developmental issue. Ventrogluteal site is also okay to use, and we can use that for any age immunization administration site. We got a couple of videos listed here for you. Those of you who are the visual learners in the class and like videos, these are some that I have checked out and are reputable as well as accurate. The bottom line here is it's important to respect the parents' ultimate wishes. If the parents don't want the immunizations, we provide all the information we possibly can so that they are making an informed decision. But on the other hand, we don't admonish, we don't provide our opinions. Remember, we've talked about communication in the past in level 1 classes. The next slide here shows a prototype drug chart for the varicella vaccine, and varicella vaccine will be our prototype for the immunizations. Do be sure to look at the pharmacology textbook. On page 437 is a prototype drug chart 31.1 that talks about the varicella. Using the pharmacological data for varicella vaccine, you may want to complete this drug card that's provided here on the next slide as a template just to be able to be familiar. But we will be testing on varicella vaccine as our prototype for immunizations in exam number 1. And here's a picture of the template for the drug card that you may want to complete in order to help organize your information about varicella. Very important to pay attention to this chart in your pharmacology textbook, page 439 and 440. Nursing interventions for varicella vaccination administration as well as patient teaching. Nursing interventions, and be familiar with the rationale, because we want to ensure that our client has appropriate information. So strictly adhere to vaccine storage requirements. Remember, the varicella is a live attenuated immunization, and we do need to draw it up at the time that it is administered. It needs to be kept cold right up to administration. Document, document, document. If we don't document, it wasn't done. So document completely. That is date, route, site of administration, the vaccine type, the manufacturer, the lot number, the expiration date. These 4 pieces, vaccine type, manufacturer, lot number, expiration date, are really important, because if there is any type of recall on that particular manufacturing lot, we need to be able to find exactly where it had been utilized and who it was administered to. And then last but not least, your name, address, title of the person administering the vaccination. Important patient teaching materials or information includes clinical manifestations, and those also will be listed on that VIS, vaccine information sheet, that you'll be obtaining from the CDC website. Usually the healthcare provider downloads those, prints those out, has multiple copies available, but if it's not something that has been prepared ahead of time at the time of administration, before administration, be sure you're giving that information to the caregiver or the parent who presents with the child. Let's see. I mentioned about the VIS. The VIS is available from the CDC. It is required by law. It's not optional. We have to give it. Take the record of every office visit to have completed based on assessment of the immunization history. Okay, I think we've got everything covered there that was in my notes. And then the bottom line is don't wait, vaccinate, share, highlight, address, remind, explain. It's really important that we go through all of this information with the parents, share reasons why the vaccine is right for the patient. Sometimes parents are not really cognizant of the severity of the disease, like with varicella or chickenpox, and how uncomfortable that is for children and the potential respiratory complications. Address the parents and the patient's questions about the vaccine. Don't try to hedge around it or avoid it. They may have fears, they may have concerns, and these are real to them. So we need to provide accurate information. Additionally, remind them that the vaccines protect against disease, and explain the cost and consequences of getting the disease and the long-term potential effects of getting the disease. And that is all I have to say about immunizations. Do be sure to pay attention to your pharmacology textbook. Remember, from level 1, pharmacology, a patient-centered nursing process approach. It's referenced here and was utilized for developing this PowerPoint along with your textbook, Perry and Cashin and Elder, the 6th edition. So thank you so much for your time and attention. Have a wonderful day.